So now you're here to get help. And because you've already been to your primary care doctor, you've been to your specialist, you've researched the internet and read books, and you still don't feel well. And I liken it to learning how to fly a plane. So you can download that manual online and maybe even pass a test after studying that, but you still don't know how to fly that plane. And so your next step is to sit in the cockpit with that pilot and watch that pilot fly the plane and learn from him. But it still doesn't mean you're ready to go solo. Until you're sitting in there flying that plane yourself with that mentorship, that when you're having the pitfalls, when you have the questions of being able to ask an expert, that's what this program offers you, is that ability to learn how to fly that plane, and learn how to achieve your health, and then fly solo. Because not only do we want you to be healthy now, we want to teach you how to maintain those changes and also share this with your family. According to the World Health Organization, 90% of all diseases prevalent today are not treatable with orthodox medical procedures. We know that there's a world of options out there that have wonderful science really behind it. And unfortunately, when a lot of medicine is trained within this certain box, we don't realize how many wonderful opportunities there are outside that box to get people well. Not everyone follows the rules. We have to be creative, because your body is different than the next person's body. One person with heart disease does not look the same as the next person with heart disease. We have to look at you as an individual. Now what? We have to order the right test for you. We have to figure out the underlying cause, or else we'll never get you well. We have to look at you as a whole, not just an organ, and not just put Band-Aids on the symptoms. And we need a systematic approach, and we need to have mentorship. Our goal is to not only get you well now, but to keep you well. And to do that, we need to give you the tools to help yourself and your whole family. So 94% of all failure is due to not having a system. We have to have a systematic approach to put all the pieces of the puzzle together. We have nutrition, fitness, hormones, nervous system, and detox. Detox is one of those funny things that doesn't get a good rep, in the media. But the reality is that we have to address this. And even in my own home, where I try to keep my house clean of toxins, we use natural cleaners, we try to eat organic food when possible. I had the opportunity to do a test on my children to detect toxins in them, and I was expecting it to turn out great, but it did not turn out great. My 4-year-old was 95th percentile for Roundup in her urine, among other pesticides. She has 5 times the limit of the 95th percentile of a certain pesticide in her urine. I was horrified. And the reality is that we cannot escape the environment. You can't even go to an abandoned island somewhere. You're still going to have toxins there. So that's not the point. The point is that we have to be more resilient. We have to improve our health and eat all the right foods, because foods have detoxing effect that's natural, like broccoli and cilantro. So if we learn how to eat properly, we can naturally detox our bodies and not have to worry about it, and we could be more resilient. So now we need you to be proactive. We got to get you up out of bed, ready to make these changes. What I want you to do is feel comfortable with how ready you are. Like, everyone who smokes, they know they need to quit. They know it's bad for them. So some never quit, and some can just put the cigarettes down and quit right then. You've got to be ready, and it's okay. There's no judgment. So if you're not ready to make dietary changes or lifestyle changes, it's okay. You'll get there eventually, and when you are ready, I'm going to be here. But if you're ready, I'm ready to help you. It's way more gratifying to work together as a team when you're on board and I'm on board. And I give my whole heart to my patients when I work with them. And for me, I want to see them on the other end of the program so much better and happy and satisfied. But to do that, you've got to be ready for the change. So if you're ready for the change, let me know.